All right, so welcome to our podcast. Today we're going to be talking about cross-cultural healthcare systems. First off, we're going to give you a slight overview of all of our countries, being China, Cuba, and the United States. So Claire, take it away.
So, an overview on the healthcare system in China. The central government is responsible for the legislation, policy, and administration of healthcare, specifically the National Health and Family Planning Commission. So, local governments, otherwise known as the Local National Health and Family Planning Commission, provide the healthcare services according to local circumstances, but they have little flexibility for carrying out provincial health policies, so they mainly focus on providing care. There's both public and private insurance, and the public insurance is provided in three forms. One urban employer-based for employed urban workers, one urban resident basic for unemployed urban workers, and the last is a cooperative medical scheme for rural residents. Private insurance also covers cost sharing and gaps in the public health insurance and is for access to better healthcare quality and higher reimbursements. People are not required to register with a general practitioner, and referrals are not necessary to see outpatient specialists. And this will affect access to care later. So the infant mortality rate, as stated earlier, was 11.8 per 1,000 live births. So it was thought that barefoot doctors contributed to this drop in infant mortality rate because before infant mortality rate was really high. And barefoot doctors were peasants that received short, intensive training, and they would travel throughout rural China and to provide free basic medical services. So these were abandoned as reforms in the 1970s and 1980s favored market-based healthcare. So China devotes resources to specific health sectors now, and that's why pre- and postnatal care are so prevalent, and it added to raising the infant mortality rate along with the barefoot doctors. However, access to care is 1.79 physicians per 1,000 people and 4.2 hospital beds per 1,000, which is really, really low. Their primary care system is basically non-functioning. So there's a great disrespect for general practitioners because they're paid less than specialists. So as patients prefer specialists over GPs, there was an increase in specialists and a decrease in GPs. So doctors would prefer to become specialists. And since you don't have to register with a GP and since there's a lack of gatekeeping to see specialists, this leads to really long lines at urban hospitals and also leads to less individualized medicine because specialists are seeing up to 200 patients a day. So this leads to a lot of frustrations and distrust of doctors in the hospital, which has led to violent outbreaks, which is almost common now. Although 95% of the population is covered with health insurance, people pay a lot in out-of-pocket. So as the health expenditures rise significantly, the government is trying to control this by encouraging visits to lower-cost village clinics. But as we said before, this leads back to the fact that there's not as many GPs and people are specializing more, which means that the healthcare is more in the hospitals and the rural areas are neglected, which is where we see a lot of severe disparities in the accessibility and the quality of the healthcare. So although China has still improved, there's still a lot of disparities. So the mortality rate for certain diseases is higher in rural areas than in urban areas where the hospitals are, as we said before. Village doctors are also undertrained, so that also leads to higher mortality rates. And then due to the variety in insurance packages and income inequality, that also leads to disparities in that some can afford private health insurance on top of their public health insurance, or their public health insurance won't cover all of it and they're paying a lot of out-of-pocket, and so they can't afford health care. In terms of individual versus mass healthcare, China has moved more towards mass healthcare, as we've seen a loss in these barefoot doctors, and doctors are seeing tons and tons of patients a day, way more than U.S. doctors, and so it's harder for them to focus on the individual, especially these specialists who are seeing 200 patients a day in hospitals, and these patients are coming from everywhere, so they don't really have a good understanding of their patients.
So when you're looking at the US, the American model of healthcare has moved towards the mass healthcare model. People are diagnosed more on the basis that they check a specific box on a long line of symptoms. The care is more geared towards treating the body and not the individual and the complaints that they have. We know that there really is no shortage of doctors and physicians. They are seen as the trusted sources, having been subjected to 8 years plus of schooling. However, this technical education can lead to them not listening to what their patients are expressing. As far as access to healthcare goes, one must have insurance for the most part in order to receive care at a reduced rate. In comparison to other developed countries, the United States falls short on giving every citizen access to care. Some problems with our healthcare system is that it's very politicized. Government officials really have a big say on how one can go about receiving care, more looking at the fight on Medicare and Medicaid. Infants and mothers in the U.S. don't have as good of a chance in regards to other developed countries. The top 5 causes are birth defects, preterm birth, maternal complications, sudden infant death syndrome, injuries. However, some of these deaths can be prevented with neonatal care. However, not all mothers have the ability to receive such care due to lack of insurance. Just in terms of numbers, the U.S. is looking at 2.59 physicians per 1,000 and 2.9 hospital beds per 1,000. So there's really no shortage in comparison to Cuba and China.
Healthcare in Cuba is free and equal for everybody and paid for by the government. Many people around the world see the system as one of the best. However, this is not the case. There are no private hospitals or doctors, and people don't have much choice in where they go for care. There are neighborhood primary care clinics that people are assigned to based on where they live. It is up to that doctor to determine whether they need to see a specialist and send them to one. Since government pays for the health care, they're heavily focused on preventing problems to try and avoid having to treat the problems. When it comes to babies, if there are any signs that the baby will be born with issues, it is aborted. For every 100 live births, there is an average of 75 abortions, many of which the mother did not give consent for. Their theory is that if they only let healthy babies be born, the government won't have to pay as much to treat their potential problems later in life. Cuba's infant mortality rate is 4.4 infant deaths per 1,000, while the United States has an infant mortality rate of 5.7 infant deaths per 1,000 live births. The number of abortions happening severely deceives the infant mortality rate, which is technically better than the United States. This country has very little medical resources and has to reuse many things that we would never consider reusing, such as gloves and syringes. They also do not have access to things such as drugs and tools for treatment and diagnosis, such as MRI and ultrasound machines. Even though the resources are limited, there is no shortage of doctors in Cuba. There are an average of 8.19 physicians per 1,000 people, while the U.S. has an average of 2.59 physicians per 1,000 people. Since Cuba is currently under a communist rule, people do not have much say in the jobs they work. Many jobs are not stable and money is not guaranteed. Being a doctor means that you get to choose the line of work you are in, as well as have consistent money coming in. Doctors only make $25 to $30 a week. However, consistency is critical to people. There are so many doctors in Cuba that they are often sent around the world to help with global health crises such as the Ebola epidemic in Africa. The Cuban healthcare system is focused on the mass health model. Since government pays for everybody's health care, they're focused on treating the population as a whole, not specific people. If they can prevent a problem that affects a large number of people, they'll focus on that.
What are the differences in the healthcare systems between the 3 different countries?
So when you're looking at the US, I feel like the biggest difference in healthcare is the idea that doctors are the ones who are trusted and you're supposed to, take their word and then not really question it, along with the fact that healthcare isn't as universal as China and Cuba. In the US, we kind of have like that view that not everyone is supposed to have healthcare and that it's not a universal right. And we clearly see now that that is really at the detriment of our own citizens.
Yeah. But it's interesting because, like, China has universal health care, but they also, like, they pay a ton of money out of pocket. And then, well, they pay a ton of money out of pocket, I mean, in relatively speaking, with their care, but also they don't get, like, they have a lot of, like, disparities. So even though everyone's covered, the rural families aren't covered, like, very well. They don't get high quality care. They die from a lot of diseases that urban families don't die from. So I feel like that's like a big give and take. Is like, how good can you provide it if, like, it's publicly and universally provided. Although it's like only 95% in China, I think, that everyone's covered. So it's not necessarily like Cuba.
Yeah, so in Cuba, obviously they have government provided health care, so everybody gets equal health care for everybody. And however, they're severely deficient in resources. So they're not getting any new resources in, so they have to reuse their syringes and their gloves, and they basically reuse them until they're not usable anymore. They don't have any really good sterilization practices in place, so often the equipment's not appropriately sterilized, and they're using stuff from the 50s and 60s. That's the most recent equipment that they have, which is shocking. So obviously everybody has access to healthcare, but it's not great healthcare.
And they don't pay anything into it, right?
No, they
don't.
They don't pay anything
it's
into
just,
it.
Yeah, it's just like their taxes and stuff. Okay.
So how do we see like Paul Farmer's view on structural violence present and the differences between these countries and then just like in general around countries throughout the world?
I feel like there's definitely structural violence in that, like, the poor in China are the ones who are, like, suffering. And then, like, as, like, it's become a lot more, I wouldn't say privatized, but, like, more, they had to, like, find a way to get money because they couldn't cover everyone. And so then everything was, like, more money-based. So when they lost, like, the barefoot doctors who served, like, rural people, I think that that was something that, like, affected the health of those in the rural areas, because they'll go to doctors in the city, they'll go to specialists in the city and have to wait in these huge lines. Obviously they're not getting cared for, and they're not getting any primary care, and then they're dying from diseases that people in their country aren't dying from.
Yeah, I feel like, especially with the US, we have so many resources and countries. Well, you would think that like China would have better resources for their healthcare.
Yeah.
Even though they aren't like considered one of the Western countries, they're still more developed than most countries that are sitting like in the Eastern world, and we really don't see them as a developed country, like an underdeveloped country. So it's really kind of like shocking to see that there's such a disparity between who can get healthcare. And even so with like Cuba, like to not have like syringes and like gloves and things like that, I feel like it's pretty bad that the rest of the world is sitting around watching these countries have to go through all this and have the lack of care and resources available to treat their citizens when everyone else is thriving, being able to give appropriate care, and there's no shortage of things to make that happen.
Yeah, so in Cuba there's obviously a large amount of structural violence happening, so obviously the lack of resources is huge for them, but also they are assigned to a doctor strictly based on where they lived. So they may not have access to as good of a doctor as people in different neighborhoods, and they don't have a choice of what doctor they go to. They have to go to that doctor, and then that doctor can send them to a specialist if needed, but they are required, they have to start there. So that's another inequality between people of different neighborhoods of Cuba.
Yeah, so the government has a lot of control in their lives and they have very few choices.
Yes.
Yeah. So what are some of the similarities in the healthcare systems between the three?
Yeah.
I think the way China runs their insurance is similar to the U.S. because you pay even public insurance, you pay premiums, but I think it's subsidized. So you pay a premium still, but it's not probably as much as private health insurance, where you're probably paying higher premiums.
Yeah, so Cuba and the US, in both systems, you start out typically with a primary care physician. So even though in Cuba you don't have a choice in your primary care doctor, you start out with a more generalist and then you go to a specialist, which is also similar in the US. You typically start out with your primary care doctor and then they send you elsewhere. So that's a similarity between the two.
Yeah.
I kind of feel like the U.S., in a sense, sits in the middle of both of the countries because even though, like, yeah, we have health insurance and everyone is paying it in through, you know, their work, employers and things of that nature, there's also the list that the insurance companies put out saying these are who are covered or like what doctors are covered. So it kind of restricts you on who you can even go to, even though it's not explicitly stated like in Cuba where you have to say, hey, this is your doctor, this is where you're going to go, this is who's going to treat you. But at the same time, like, say you wanted to go to a dentist that you know is well known, but they don't take your insurance, you're not going to that dentist.
Yeah.
So
yeah, it's interesting. In China, they don't have any restrictions. Like, you don't have to, usually with like a unit or like a public healthcare, you would have to sign up. Like in Cuba, you have to sign up with like a family doctor or a general practitioner. They don't have that, and they don't have gatekeeping. So like your primary care doesn't really exist anymore because of like the stigma it has, and they go straight to specialists, which is like, it's like the preferred thing to do is to go to a specialist. So you've got like tons of backups at hospitals and stuff in the city, which is, it's interesting. Like they have choices, but in a way they don't really have a choice because everyone wants to go to the same person, you know, and or the same area and the better quality care, and they also pay like a ton of money for it. So the insurance, no matter what, you're paying huge out of pockets for your visits and stuff and your care.
Yeah. So from researching these different countries, is infant mortality rate a reflection of the country's healthcare? And why is infant mortality rate such an important statistic within that country? So I think for Cuba, the answer would be no. So they have a lower infant mortality rate than the US, and the US is developed and Cuba is still developing. However, they're performing an insane number of abortions to prevent health problems down the road. So their infant mortality rate is very deceived by the number of abortions that they're performing. So obviously we've seen that their healthcare system is not in a good place right now, especially with the lack of resources and all of that. So their infant mortality rate would definitely not be a good reflection of the overall health and well-being of their country.
And they don't report the abortions, do they?
No, they do not report the abortions.
So just as a recap, the U.S. is sitting at 5.7 infants dying per 1,000 live births. And the CDC is saying that, like, the infant mortality rate is an important marker of the overall health of a society. So for a developed country like the U.S. to, like, be sitting at number so high in comparison to all the other developed countries sitting out there, like, you know, Norway, Finland, and, like, European countries and things of that nature, it just really points to the fact that we're doing something wrong. especially when there's a stereotype that, oh, developed countries are worse and things of that nature as far as what health care they can provide and the services that are out there for their citizens. It's little.
Could be better, yeah.
It could be better. But at the same time, the way that Cuba like runs theirs, it's kind of like similar to the whole Nancy Shepherd Hughes and like the Brazilian babies and how the mother had to like make the decision.
Oh yeah.
Am I gonna, keep the child and then let the child be at risk of dying, or am I going to raise this child up and take a risk and then, put the rest of the family in danger? So
it's interesting that they don't report it, like an abortion as a mortality, because you'd think that in a society that's developed and with good health care, you'd have the confidence that you could have a child and you could raise that child and it'd be in general good health. Even if it started off maybe not so well, you could keep it alive. So I thought that's kind of wild.
I think Cuba, since the government is paying for the health care, they don't want to spend the money to bring them up to health.
Oh, okay.
Their point of view is, if we only let healthy babies be born, we won't have to spend government money on getting them back to health.
Yeah, which, I mean, that's interesting. I mean, I don't know. I would say that's like a sign of a healthcare that needs to be fixed, because like you should kind of have that confidence. In China, they allot like a lot of their resources to certain sectors of the healthcare, and one of them is infant mortality, and I'm sure it's because that's kind of like the world's view of like what's good healthcare. And it's high. Like it's high. Their infant mortality is like 11.8 per 1,000 births, and I think that has to do a lot with the disparities. And a lot of people see like now they're getting better, way better than they were before, because like the women like sign up with they get prenatal and postnatal care. Like a high percentage of them get prenatal and postnatal care. I think it was. I can't remember, but it's very high compared to a lot of developed countries. But they also don't. They lost a lot in the rural areas. They lost a lot of the doctors that used to like the barefoot doctors who used to take care of them due to like money, and so I could see where that is still high. Is there's a disparity between the rural and the urban areas.
Yeah, in Cuba, so they have a very involved prenatal care system. So the moms, since it's communist, they kind of don't have a choice, but they see prenatal doctors, they see a nutritionist, a dentist. The doctors make home visits to make sure that the home is adequate. So that's all great that they're getting this very involved prenatal care. However, since the government is so involved, that's where the abortions come into play. And so since they're there every step of the way, when they sense a problem, they force the mom to have an abortion. And oftentimes, the moms don't give consent, which I think is insane.
You think it'd be it's like so invasive, I feel like.
So with respect to these different countries, what do you feel hinders or promotes the access to care?
So I'd say with Cuba, I mean, kind of the access to care, you have access to care to one primary care doctor, but since you're assigned to that one, you don't really have access to specialists or anything else unless they send you to one, and I'd imagine you would have to be very, very, very sick for them to send you to one, since they don't want to spend the money on that. And then also in Cuba, the resources. I mean, that's just another huge thing for them.
Yeah, I think in China it's like a lot of different mix of things. So it's the not signing up with a general practitioner, the no primary health care, where everyone's going to see specialists. I think it's the amount of people that are going to see specialists, and the amount of people going to like certain hospitals. I think it's also the disparity in wealth. So those who are wealthier can afford the private insurance, which covers any gaps in the public health insurance. So I think that also limits access to care because those in the rural area can't afford some of the out of pockets that they have to pay for their health care, and they're not getting quality health care, which also creates even a bigger disparity. Is you may be getting health care, but you may not be getting quality health care.
With the U.S., I feel it's really put behind the disparity in the wealth. Because if you're not wealthy, you're not going to have access to insurance because the U.S. says insurance and healthcare are not a right that, everyone is born with. So if you're a low income person and you have diabetes, you're really playing a chance with your life in the U.S. Just because you have to make so many sacrifices in deciding, do I pay for food for me and my family to eat, or do I pay for the medicine that keeps me alive? And if the U.S. really, kind of pushed past the fact that everyone should get health care, I think we'll be sitting personally in a better place going on from now.
So how does having individual versus mass healthcare affect the country's healthcare, such as quality care, access to care, etc.?
I think for all the countries, I'm speaking for all the countries, they're all kind of like a mass healthcare system. And I think just from reading about China, it's really hurt the individual. The individual has no trust in the doctor. They're not getting good care. Well, some of them are getting good care, but it's hard to even see a doctor because there's so many people that are trying to get into certain doctors. So I think that it shows that the doctors in China, that I read this one article, the doctors in China that they interviewed that focused more on the individual, those individuals are happy even though they were standing in lines and waiting for the doctor. So it would be sad if they moved even further towards mass healthcare because it's just creating this huge distrust and frustration between the doctors and the patients.
Yeah, I know Cuba is obviously definitely mass healthcare because since it's all government paid for, they're more concerned on treating the masses. So how can we fix large, widespread problems across the country? So if we can eradicate a disease or get rid of big problems, those are big wins, as opposed to just treating the individuals.
Mm-hmm. The U.S. for sure sits mass healthcare all the way. We really find a way to treat the boxes that people check that match a diagnosis.
Yeah.
Instead of treating the complaints that a person has. And by generalizing what they're feeling, it really takes the person aspect out of it. And the doctors really are only looking at a body and not a person. And that's really controversial when you think about, doctors are supposed to care for you, make you feel better, and really try to alleviate everything that you're feeling. And everything that you're feeling isn't just, you have an infection that's coursing through your body. It's this infection makes me feel this way. I don't like this, that about it. Is really affecting my daily life as a person. But we find a way to really put and make a dichotomy out of the body and the soul of the person.
Mm-hmm.
So.
Yeah, good point.
So that's all, folks. Thank you for listening to our podcast. We hope you learned a lot about the cross-cultural healthcare systems from the 3 different countries that we focused on today.
This podcast is brought to you by Medical Anthropology, taught by Paul Christensen.